Hello, my name is Najimu Akanji. I'm a mental health nurse practitioner student. I'm going to talk about my most interesting patient of the week. My patient is a 47 years old female patient who present to the clinic earlier than her scheduled time. Patient is alert, oriented to time, situation, person, and environment. Patient present with steady gait, well nourished, well groomed, clothed fit, and worn appropriately. Patient chief complaint was that she's feeling depressed and she doesn't have energy to do anything. Patient states that she stopped taking her medication due to serious side effects she's experiencing from those medications. Patient identify major medication that she's experiencing side effects from. Patient states infection is giving her diarrhea. Webutrin makes her hungry, and uh, um, lesser pro makes her feeling having cramps. As a result of this, we explore from the patient that is there any other side effects she's experiencing from other medication. She states only those three medications are making her feel sick, and that's why she's here. Patient stressed further that her depression is getting worse since last week when she stopped talking to her boyfriend when they broke up, and now she stopped taking the medicine and she come back for help. Provider and I explore further from the patient and ask her if she's having any suicide ideation or homicidal thought. Patient denies suicide ideation, denies homicidal ideation. However, patient stress that some of the medicine are making her want to do bad stuff. We ask him to clarify what does he mean by bad stuff. Patient states that our plan is to have sexual intercourse with her ex-boyfriend close friend in order to hurt his feelings. We advise him not to do so, and we explain danger and risk associated with uh, proximity sexual intercourse. Patient verbalized understanding of the teaching. Furthermore, provider reviewed the patient medication and make some changes. Provider discontinued patient Lesapro, Webutrin, and Infection. Provider starts the patient back on Zoloft 150 milligram every morning for depression, Trazodone 100 to 200 milligram every night for insomnia, and Fisterol 50 milligram by mouth every 6 hours for mild anxiety. Patient agreed to treatment medication and the patient agreed to the current medication plan and treatment plan. We strongly encourage the patient not to hesitate to verbalize our concern or not to verbalize our concern or not to hesitate to call us back if she's still having symptoms, if the symptoms persist. We explore further from the patient and ask her if there is any coping mechanism the patient has used in the past to cope with the stress, anxiety, and depression. Patient states that in the past, what really worked for her is to call her mom whenever she feel depressed. We encourage her to continue doing that. So also, I asked the patient if has she ever done anything to hurt herself. Patient denies thought of self-harm or other. I encourage the patient to continue exercising 2 to 3 times a day. Patient stress that she used to go to a Zumba class 2 3 times a week, but since she broke up with her boyfriend, she stopped doing that. I advise the patient to continue going back to the gym and to engage in a Zumba dance to control her emotion and to get out of the depression. Patient agreed to do that. What I really found out about this week clinical practice is that as a provider, we must continue to utilize open-ended and closed-ended questions to explore patient concern so as to provide and initiate appropriate psychiatric care that will improve patient safety. Also, as a provider, we must continue to show empathy and utilize clarification and reflection during provider and patient encounter in order to promote treatment adherence and trust between the patient and the provider. Also, lastly, I found out that I reviewed some of the medication that the provider provided order for the patient. I went back to drug guide and I found out that SSRI causes weight gain, in which a parcel was described as the most offender. That is the medication that causes most weight gain is parcel. Thank you.